So fat transfer is not a new operation. It's been there for a long time, but there was issues about whether people were confident with regards to the procedure. And with time, people developed more experience, and it has proven to be quite effective for mainly corrective surgery with breast cancer patients. However, it has been used, or it is being increasingly used as a form of alternative to breast augmentations, or as a combination with breast augmentation, as a composite procedure, for example, to decrease the size of the implant that you use, or to just have a modest increase in your breast size, rather than a significant increase that an implant can do on its own. It can also use to sculpt certain areas in the breast. So if you have, emptiness in the upper breast, you can use that to just fill that area and give you a cleavage, for example, rather than the whole augmentation. So yeah, and the way it works is you take the fat from other places in the body, and then you prepare that fat, and then you inject it back into the breasts. I think a good candidate is a healthy candidate that doesn't have significant medical issues, non-smoker, and they need to be, the worst. I don't want to say the worst ones, but the ones that are very difficult are the ones that are very thin. Obviously, they don't have fat anywhere. So, I think if you need to have this done, then you need to have fat somewhere to be harvested. The fat is harvested using normal liposuction methods. So you inject the area that you're harvesting with some solution to try to break up the fat. And then when it's ready, you use a liposuction cannula and you suck it into a container that will there are several types of these containers, but we will process the fat one way or the other, where it's washed, prepared. You take the excess fluid off, and then you prepare the fat in syringes and make sure that it's ready for injections. And then you inject it back into the breast using another special needle. And the way it's done is that you create small tunnels with that needle, and then you fill those tunnels with fat. It's like having layers of spaghetti, or like this, layered into each other in a 3D matrix that will eventually, hopefully, get its own blood supply, and then stay there. So the recovery of breast fat transfer is a depend. Usually, the patient will be fine within 2 to 3 weeks. Again, I suggest that you take 2 weeks off work. You will need to wear a bra for your breast, and also a compression bandage to the area of the tummy if the fat was being taken there. This is to avoid bruising and to make sure that everything heals and everything sticks together back again, especially in the tummy. People do feel like quite bruised in the tummy, mostly, rather than the breast after surgery, but within a few weeks it'll be fine. The final result will be about 3 months to 6 months later. Now, depending on how you prepare the fat, you will lose some of it. So the initial fat that is there, some of it will get absorbed, that will not take its blood supply. So what we do is we inject as much as we can, but we can't inject more than a certain amount because the body is not going to take it. So this is one of the drawbacks of fat transfers, is its unpredictability, because unless you're willing to have several procedures and you have enough fat, then it's quite difficult to predict what is going to happen with that fat. But whatever stays there after about 3 to 6 months will stay there. There are risks with breast fat transfer. Obviously, some of these can stay in the breast and not take, and then form like cysts and lumps. And these, therefore, you will require a baseline assessment before you have the operation, just to see what your breasts look like. With regards to the donor site, there are potentials there where there's contour defects, or there are defects where we've taken the fat. These are, and also obviously the pain that we spoke about and the unpredictability. But all in all, this procedure works well in the right patients, but it's not something that is suitable to a lot of people. So from my practice is that a lot of people that come initially thinking that they wanted a breast transfer. Once we have the chat about their suitability and about the predictability and potential need for several surgeries, they tend to go down the route of having a breast implant rather than fat transfer. And I think it's a good operation in very few people, but it's an excellent operation for reconstruction and cancer surgery, which is different.